Okay. As a physician, I receive a lot of questions from patients who have medical issues. And here's one that a lady wrote to me about her husband. My husband is on blood pressure medication, and he says that it makes it difficult for him to get an erection. Is this true? Is there anything I can do to help him? Or do I just ask him not to take that medication one night a week? Please help me. Blood pressure medicines do make it more difficult to achieve an erection, but some medicines are worse than others. The ARB medicines and the ACE inhibitors are thought to be better than the thiazide diuretics and the beta blockers when it comes to preserving erections. Okay? So this guy has an actual problem. He's got a blood pressure issue, and when he takes his medicine, he should go to his doctor and inquire about whether he's on the best medicine for him or if the dose could be lowered. Now, something I like to do with my patients is to give them the nutritional supplements that they need to reduce their blood pressure. Magnesium is so important, and taking magnesium can reduce your blood pressure 10 points on the top and the bottom numbers. Other things that are extremely helpful are beetroot supplements, or eating a lot of beets, or making a beet smoothie. Other things that can help are grapeseed extract. Vitamins such as folate and B12 are extremely important. Vitamin C even relaxes the blood vessels. And olive leaf extract is another one. So you start to do this, you can reduce your blood pressure, but there's one more thing. Losing weight is amazing for reducing blood pressure. Sometimes just losing 10 pounds can be enough to get the person off the blood pressure medicine. I would not do what this woman recommended, to skip the blood pressure medicine, because any elevation in blood pressure that's very high can be dangerous, and it can damage and weaken a blood vessel that in the future it could give you a stroke. So we don't want to do that. We want to make the blood pressure normal through natural means if possible. If we can't do that, with medication. Okay, and there's another thing your husband could do to address this problem, and that he needs to see a physician for. He should request some Viagra. Okay, something like that is very useful for men with erectile problems. That was my advice as a physician. But my advice as a sex therapist is, when you're dealing with a man who's having an erection problem, try to concentrate on your own sexual pleasure. That is, if you get aroused in whatever way pleases you, whether that's self-stimulation or oral sex or whatever, do that. Take his mind off his erection problem. Chances are he could recover and regain his erection just by watching you get aroused. That's what I would say as a sex therapist. Okay, if you have questions that involve both medical knowledge and sex therapy advice, please don't hesitate to write to me. I would love to share my information with you.